Infection Control, Module 8, Homebreed Training, 48-hour Personal Care Basic Training. We will be looking at what infections are and how they are spread. We will also look into the definition of standard precautions and the strategies to control the spread of infections. Infection and germs. So what comes to mind when you see the word infection? Infection is when conditions or diseases that happen when germs enter the body and grow. So what about germs? What are they? Germs are microorganisms that are everywhere inside and outside our bodies. Types of germs. Some germs are considered helpful. Others cause diseases. There are 4 common types of germs. Can you name them? The first common type of germ is bacteria, viruses, fungi, and the last one, parasites. Cycle of infection. An infectious agent can be a person, place, or an animal. Take a look at this graph and notice the chain of infection. Keep in mind that the host or the agent may or may not show signs of infection or illnesses. This is also called the carrier. How do germs travel? Go get a pen and a piece of paper. Write down and list how do they travel. Consider how germs could get into a new host through a different path. In the air, contact with body fluids. We will look into this in more details later. Contact with animals. Insects. Food. Water. And skin-to-skin contact with open wound. Not everyone who is exposed to germs will become infected or get sick. Who are the people most likely to become sick after exposure to germs? People most likely to become sick after exposure to germs include children, elders, people who are already sick, people with poor nutrition, people whose immune systems are weak, people with poor hygiene or poor living conditions, people who are overtired or stressed. So what are the symptoms or signs that someone may have an infection? If a cut is infected, fluid comes from the cut. It hurts. The skin around the cut is red and puffy, and the skin will feel warm to the touch. If an organ or body system is infected, pain in the infected area, nausea, fever, chills, and very tired. These are only some signs of infection. Preventing and controlling the spread of germs. Body fluids. When you are caring for a consumer, what body fluids could a home care provider come in contact with? Get a pencil and a piece of paper. You have 2 minutes to list all the types of body fluids that you may come in contact with when caring for a consumer. When caring for a consumer, a home care provider could come in contact with urine, feces, blood, mucus, vomit, phlegm, pus, semen, vaginal secretion. Infection control strategies, standard precautions, and consumer education. Infection control and standard precautions. So what is infection control? Infection control is things you do to prevent or stop germs from spreading. For example, wash your hands. Washing hands is one of the most effective ways to prevent the spread of germs. What about standard precautions? Each time a provider assists a consumer with personal care, like brushing teeth, toileting, or shower, provider needs to understand and take standard precautions, meaning using infection control practices to prevent contact with consumers' body fluids. That said, we need to assume that all contact with all body fluids from every consumer carries a risk of infection, since you, the provider, cannot always tell if someone is infected by just looking at them. Grab another piece of paper. List when a provider should wash their hands and/or wear gloves. You have 2 minutes. When to wash your hands. The following situations are recommended to do hand washing: before and after touching a consumer, after touching a soiled or dirty item or surface, when you leave a consumer's home, cough, sneeze, or blow your nose, when you tear your glove, after using the toilet, eat, drink, or touch food, continue from previous slide. Put on your makeup or lip balm. Each time you smoke. Touch items used in personal care, like a toothbrush. Touch your contact lenses. Each time you put on gloves and take off gloves. It is not recommended to wear disposable gloves for a long period of time. So, as a general rule, wear gloves anytime you might touch body fluids. For example, assist a consumer with daily tasks such as toileting, bedpan, or urinal. Touch dirty clothes or linens. Change bandages or dressings. Clean areas where body fluids have spilled. Collect or touch urine or stool samples. Continue from previous slide. When to use gloves. Press down to stop bleeding. Touch dirty items used in personal care. Touch dirty or bloody linens, towels, or clothes. When you help with bathing. Take care of their mouth. When you clean between their legs. When you change their pad or briefs. When you clean their catheter. General cleaning tips. These include detergent and hot water, bleach and water, vinegar and water. If your consumer uses a needle, here are some tips. Never handle a consumer's syringes unless you have been trained by the home health nurse. Always have your consumers disposal of their syringes in a sharp container. These red containers can be obtained from any pharmacy. To pick up a syringe from the floor, sweep it up into a dustpan. Handling sharps continue. Put the dustpan with the syringe in it on the table and ask your consumer to place the syringe in a sharps container. If the consumer does not have dustpan, use magazines, newspaper, cardboard, or any other flat object to sweep the syringe onto the table. Ask your consumer to put the syringe in a sharps container. Never use your bare hands to touch any syringes or needles. This concludes the module of infection control. Protect the consumer and yourself by using infection control strategies. The first thing you do is turn on the water, adjust the water temperature. This is good. Okay. Then use one hand with your soap, wet the other hand, work it into a lather, and you wash for at least 20 seconds. This is the recommendation from CDC, but at Homebridge, we watch it for 30 seconds. So you can sing happy birthday twice. Happy birthday to you. 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 Happy birthday, happy birthday, happy birthday to you. If you have long fingernails, make sure that you get under each one. And if you have jewelry like rings, you can lift up a little bit and wash underneath. And then you rinse for 30 seconds. Get a good rinse. When you are done, do not shake. Let it drip. Turn off. Pat dry. You should always carry your own towel. Okay, now that you wash your hands, the next thing is that you're going to get the gloves. Right, the two. Do not shake. And the way to get your gloves ready, this is to make sure that there's no hole and actually helps. Oops, I have one extra right here. Put it on. Now you're ready to work. When you're done, make sure you start from the center of your palm. Okay? If your hands are sweaty, you can actually pull it down a little bit to help you get the gloves off. Once you've done that, you can start pinch, pull down, roll it into a ball, 2 fingers, slide down, take off, throw it out, and wash your hands.